me just read a little bit about Dr. Martin. He's a UCSF clinical professor. He's going to talk about the dangers of eating red meat. And I have to tell you, Dr. Martin, everybody here did not order any hamburgers. However, there was bacon in my turkey sandwich. So, Dr. Martin has been involved in a variety of research projects with a focus on preventive medicine issues. These research projects include the relationship of cholesterol levels to heart disease, the effects of passive smoking on heart disease, the cost of firearm injuries, sunlight, aging effects on the skin, and the excessive use of antibiotics in animal agriculture. Dr. Martin teaches at UCSF, and for more than 30 years, he saw patients in the general medical clinic at Zuckerberg San Francisco General Hospital, an affiliate of UCSF. Okay, Dr. Martin, you can take it over now as soon as I...
Great, thank you. Let me see if I can share my screen here with you. You see my blue screen there?
Yes.
Yes.
Okay, let me start the slideshow from the beginning. Okay, you see that slide?
Yes.
Red meat, should we be concerned? Great. Again, thank you for the nice introduction. I'm with UCSF, and I'm also with a group called Physicians for Social Responsibility. It's a Washington DC based group that's been around for many years, since 1961. I'm the president of that group, and it addresses primarily climate change and the risk of nuclear war. Those are two very relevant topics these days, as you must know. And PSR won the Nobel Prize in 1985 for its work trying to reduce the risk of nuclear war. So it's a great organization, been around, and I'm happy to serve as the president this year. Let me give you a disclaimer of sorts, and that is I'm just the messenger. I don't necessarily like bringing people bad news about something they've grown up with and enjoy, like red meat, but it is a message that needs to be delivered, and I'm here to deliver it. But I take no joy in the message that, hey, this may not be the best thing for us or our planet. Okay, so my goal today is to influence your beliefs and your habits regarding red meat. Now, what do I mean by influencing your beliefs? Well, what I want you to do is recognize that red meat is harmful. It's harmful to your health, and it's harmful to our planet's health. And I hope I'll show you lots of information to prove that that's the case. I want to influence your habits, your dietary habits, your purchasing habits, what you get when you go to the store, what you buy when you order when you go to a restaurant, and your persuasion habits. That is, what do you tell other people regarding red meat and whether it's a good thing? We all have an opportunity to influence others, and I want to influence your tendency to influence others about, maybe red meat's not the best thing for us. Let's start with some definitions. First is, how do we define red meat? If I ask you all, hey, how would you define red meat? What would you say? There's dark meat of chicken. There's pork is said to be the new white meat. What is red meat? Well, it's actually quite a simple definition. And here's how I define it. And that is 4 legs. If the animal has 4 legs, it's red meat. If it doesn't have 4 legs, then it's not classified as red meat. These animals only have 2 legs, and they're not red meat. And fish don't have any legs, and fish are not red meat either. So that's a simple definition for you to remember what is red meat. I want to talk about processed red meat versus unprocessed red meat. There's quite a bit of difference between those two. Processed red meat is anything that has been cured, salted, smoked, or any other chemical added to it to preserve the meat. And unfortunately, these processed red meats include many of the things that we all have grown up with and have enjoyed throughout our lives. Bacon, ham, sausage, salami, corned beef, jerky, beef jerky, canned meats. These are all processed meats and meats that really are probably worse than unprocessed red meat for us in terms of our health. Unprocessed red meat is meats that are only cut, ground, or mixed. So nothing's added to them, only physical properties, cutting, grinding, and mixing applied. Okay, well, let me first talk about red meat and our health. And I want to first talk about overall mortality. So you can look at different kinds of mortality. That is, what do people die from? Well, cancer, stroke, whatever. But you can also look at overall mortality. That is just, well, how many people die overall from this, from one cause or another? And that's what we're going to be looking at first, overall mortality. And we're going to be looking at all-cause mortality from each serving per day of processed red meat. And the kind of analyses we're going to be looking at is something called a meta-analysis. I don't know if any of you have heard of this, but these are studies of studies. So they'll add a bunch of studies together, studies in the literature, and come out with a result. It's a study of other studies that are out there and a combination of those studies. So here's how it works. You have over on the left side all the different studies that have been done. Each one of these on the left side is a published study that was peer-reviewed and in the scientific literature. And you look at each one of these and say, well, okay, what do they show? And then we add them up. Now, if the study shows a result with the results on this side of this line here, which is a relative risk line of 1, which you don't need to remember that, but if you just remember anything on the left side, it would show a reduced risk of whatever it is you're looking at, red meat in this case. And if, on the other hand, you have all the studies on this right side, it would be an increased risk. And you can see here that this little diamond shape at the bottom, that's a summary statistic. It summarizes all the studies above. And if you get a result like this, with some studies showing a reduced risk, some showing an increased risk, you get a summary result here that shows no risk. So this is how these work. And I think you'll get it as I go through some of the slides here. So we're going to look again, all-cause mortality with each serving per day of processed red meat. So let's go through that. What are we talking about? All-cause mortality. I mentioned that it's all causes with each serving per day. So one additional serving of meat per day, breakfast, lunch, dinner, whatever it is. And we're going to look at processed red meat, those ones that are most harmful for you to start with. Here's the result of the first study. This is a summary of all-cause mortality with each serving per day of processed red meat. You can see all the studies here. They're all on the right side of this line. There's no question. They're all showing with one additional serving per day of red meat, you have an increase in mortality. And here's the summary statistic at the bottom. So that's very, very clear. A lot of times you have, again, studies, some on the left, some on the right. This is very clear. They're all going in the same direction and all showing an increase. This is all-cause mortality with each serving per day of total processed red meat. The one before was a processed red meat. This is total, including processed and unprocessed. Again, the studies that are out there show the same thing, all very consistent, showing an increase in risk and an increase in total mortality when you have one additional serving per day of red meat. There's a little different way of looking at it. This is a very large study that's well regarded in the medical literature called the Health Profession Follow-Up Study. Thousands and thousands of people in it, followed over many years, looking at each serving per day, 1, 2, 3, 4 servings per day of red meat. You can see how the mortality increases with each additional serving per day that someone eats. Okay, well, let's look at another study. Again, a very large study, the Nurse Health Study, very well regarded, used for many things, looking at many risk factors. Look at how closely those curves resemble each other. Not a lot of question about whether there's an increased mortality with red meat. Well, let's look at cancer. Okay, we looked at overall total mortality before. Now let's look at cancer mortality, one specific cause of death. Again, almost everything is on the right side here. One little tiny study, a very small study showing things on the left, but very consistent among the other studies, and overall showing that with cancer, there's a higher mortality with eating red meat. Let's look at some specific forms of cancer. Colon cancer. Again, the studies really tend to be on the right side, very consistent. So showing that there's a higher colon cancer mortality with red meat. Breast cancer, again, almost on the right side. There's one or two on the left, but really the summary statistic shows that with red meat, there's an increase in breast cancer risk. Okay, well, let's just look at different kinds of cancer. These are listed at the bottom: breast cancer, prostate, lung, colorectal, gastric, all the different kind of cancers. Now, it's going to show unprocessed red meat and processed. If there's anything above this line here, it represents an increase in risk with in that type of cancer with red meat. Here's the result. You can see very consistent increase in cancer risk among all these types of different kind of cancers with red meat consumption. Okay, let's look at stroke. Stroke and red meat. Wow, that's how'd you get to stroke? Well, it's a little unclear why red meat causes an increase in stroke, but it does. Look at how these studies line up all on the right side. So stroke is increased with people who eat more red meat. Red meat and diabetes. Again, things tend to be on the right side, showing an increase in diabetes risk with red meat. Now here we get into some really unusual things. Red meat and psychiatric disorders. Wow, now why would red meat increase psychiatric disorders? Well, it probably has to do with inflammation and inflammation of the brain, but it does seem to increase psychiatric disorders. Look at this mania here. Increase almost, this is 3.5 times increased risk of mania in people who eat a lot of meat. And again, bipolar depression, major depressive disorder, schizophrenia, all seem to have a bit of an increase there. Look at, these are meat sticks, okay? Meat sticks, beef jerky, turkey jerky. These are very highly processed meats, and they're looking at mania and the increased risk of mania. So with meat sticks, which have a lot of additives added to them, almost a 5 times increased risk of mania, a psychiatric disorder. Wow, that's really crazy. But these are the findings. Why is red meat harmful? Why is it so harmful to our health in so many different areas? Saturated fats. It has a lot of saturated fat. Heme iron is one reason. There's a lot of iron, a particular kind of iron in red meat. There's the mix of amino acids are such that it could increase the risk. And they add a lot of nitrates to red meat. Those are harmful to our health. I don't need to go into each one of these, but I just want to get across the idea that there are good reasons scientifically why red meat would increase the risk of various disorders. These are the reasons. Again, we don't need to go into them, but scientifically, you can pretty easily say, yeah, well, this makes sense why there would be an increased mortality and cancer and stroke and other things with red meat. Okay, well, that's red meat and our health. Let's talk a little bit about red meat and our planet's health, because red meat is a big problem for our planet. Why is red meat so harmful to our planet? Because it causes a lot of greenhouse gases. A lot of greenhouse gases go into producing red meat. Greenhouse gases from livestock include carbon dioxide, the most common greenhouse gas. Cows breathe it out, a lot of it. It's a lot of greenhouse gases go into just making red meat, transporting it, so on and so forth. But one of the big things is methane. Methane is a greenhouse gas that is very harmful to our planet. And cows burp and fart methane, a lot of it. Huge amount of methane from each cow that is feeding for years, really, to create red meat. Nitrous oxide is another one. You get the manure, they put it in pools, it degrades, it causes nitrous oxide to be generated from the fertilizers that go into feed, and these are very hazardous greenhouse gases. This shows the relative importance of these greenhouse gases, these methane and the nitrous oxide relative to CO2. Again, CO2 is the most common greenhouse gas that we always hear about. You know, the CO2 level in the atmosphere now is higher than it's been in 4 million years for our planet. So that's what we usually hear about. But methane is actually 86 times more powerful than CO2 in terms of its greenhouse gas warming potential. And nitrous oxide, this gas we get from a lot of manure, is almost 300 times more powerful than CO2 in terms of creating greenhouse gas. This just shows you from the year 0 going up to 2000 and the present, the concentration of these greenhouse gases in the environment. This is carbon dioxide here, the red and the black is methane, and nitrous oxides, the methane is the blue, nitrous oxide is the black. You can see these greenhouse gases, they were very steady throughout most of human history, or our history from the year 0, and now they spiked tremendously. Red meat is a major contributor to this. I don't know if you know about the Intergovernmental Panel on Climate Change called the IPCC, but occasionally we get reports that, you know, we're about to reach tipping points. This is a major problem. We need to take action now. Maybe every 6 months they come out with a report that seems to be more dire with each report. It's the leading world panel for assessing climate change. Scientists from 66 countries and 234 authors and review editors. So it's really the most esteemed group of people putting together the best guess of where we are with climate change. And one of the things they say is a key consideration, one of the simplest and most effective steps to reduce greenhouse gas production is to reduce or eliminate red meat from our diet. So this is not a small thing that we could all do related to climate change. It is probably the most important thing that the average American can do related to climate change, much more important than almost any other action they can take. Red meat is the low-hanging fruit in climate change. That is, it's something we can do, take action on today and make a significant difference today, not 10 years down the road when we all start driving electric vehicles or have a chance to change this our in-house heating to electric versus gas. No, this is going to take a long time, but one thing we can do today is stop eating red meat. This shows you the contribution, the climate change contribution of different foods. Red meat is at the top, others down here at the bottom. You can see what an outlier red meat is in terms of its contribution to greenhouse gases and global warming. The good news on this, folks, is that oils, sweets, and condiments are pretty low here, so you can enjoy your donuts and not feel bad about them, at least from a climate change perspective. Red meat and world hunger. World hunger has been a huge issue for years, as you know, but it's becoming more of an issue all the time, particularly with the Ukraine and Russia conflict. World hunger is taking center stage. Red meat is a problem for world hunger. Why? It takes a lot of grain to make a pound of red meat. 7 pounds on average to make a pound of beef, and the range can be 5 to 20. Some of the good, the best prime steaks, they can be 20 pounds of grain to make 1 pound of that meat. Pork's less, chicken is less than that. Land use. Land use is astronomical with red meat. You can see agricultural land use here. This circle represents the entire agricultural land use. 4/5 of it, 4/5 of the agricultural land is dedicated to raising livestock. I mean, seriously, I was talking to a guy yesterday and he was saying, oh my gosh, solar panels, they're going to take so much land. If we, replace all the electricity using solar, it's going to take so much land. It's a small, tiny fraction of what is used to raise cows and to generate red meat. Red meat and water use. You can see here, beef takes 1,800 gallons of water to make a pound of beef. That's a huge amount of water. And as you know, we are in a situation with water where it's getting more scarce all the time. So red meat is very intensive in terms of its water use. You say, well, gosh, why didn't somebody tell me that red meat is so harmful to my health and that red meat is so harmful to our planet's health? Well, there are a lot of vested interests in in confusing the issue, not getting this message out, and in a lot of people benefit. There may be some people in the room who fall in that category of benefiting from red meat in one way or another. And it's a message that's not very easy for people to get out there or to accept. Cigarettes were once viewed as healthy as well, and we had the tobacco industry doing all it could to promote the message that cigarettes were healthy. And then later, when it was hard to say they're healthy, at least they're trying to say they're not that harmful. And we know where this ended up. Here's something by an organization saying that red meat is the new tobacco. And in a lot of ways it is. Not good for our health and not good for our world's health. Okay, so my goal today was to influence your beliefs and your habits regarding red meat, influence your beliefs, for you to recognize with all this, information that I quickly presented, that there's a lot of scientific evidence showing that red meat is just not good for us. It's bad for our overall health. It's bad for specific issues like cancer, stroke, psychiatric disorders. And it's not good for our planet's health either. It's something we can do without, and we really should. And I wanted to influence your habits, your dietary habits. I hope you'll think about this presentation when you are thinking what you'll eat yourself. I hope that when you go to the store, you'll be a little more careful about not getting red meat, or when you're at the restaurant, not buying it. And your persuasion habits. Hey, you've gotten this presentation. You can take this message out to other people and say, hey, I've heard that red meat's not that good and that we really need to cut back on it. I didn't expect everybody overnight to say, I'm never eating red meat again. But I mean, I hope we can nudge you. I hope I've nudged you, and I hope you can nudge other people to say, no, red meat's something I don't want to make as a big part of my diet. And I'll move to other things that are just as good and more healthy for myself and the planet. I have created this organization, Physicians Against Red Meat, to try and get this message out. It's a nice website you can go to get more information and sign up for our newsletters if you're interested. So that's it, the end. am delighted. I'll be delighted to take any messages and answer any questions that you have. Thank you.
Yes, Emily.
Dr. Martin.
Yes.
Your indication was how red meat contributes to cancer, the psychiatric disorders, etc. If someone were to just suddenly cut off ever having any red meat, are there any studies that show that by cutting off the red meat, it slows the progression of these, whether it's a psychiatric disorder or cancer?
There have not, to my knowledge, there have not been any studies showing that. But there have been lots and lots of studies showing that same phenomenon with smoking. That is, if you stop smoking after a certain number of years, whether it's 3 or 7 or whatever, your risk really has gone down to almost back to normal. I suspect the same thing is true with eating red meat. Never been proven, but the science is there to say, yes, it makes sense that would happen.
Thank you. Great presentation.
Yeah,
Oh, thank you.
I have a question.
Yeah.
What about the Impossible burgers and there's also other alternatives. I think they're made with plant-based, yeah, like corn.
Yeah.
What are those good alternatives?
Yeah, though they are better than red meat, no question about it. Better for your health and better for our planet, much better for our planet's health. Would I classify them as a healthy food? No, I would not classify them as a health food. If you want to eat a health food, eat things that are whole foods, unprocessed. Yeah, but they're not bad. They're not bad. I don't think they would increase your risk of anything, cancer, stroke. They're perfectly fine, and they're very good, and they're getting better all the time. So I don't want to say it's health food. No, but I eat them myself occasionally, and yeah, go ahead, please do. They're great.
Hi, Mike, this is Wendy Marioni. Thank you so much. I really enjoyed your presentation. I just want to confirm, and by the way, Brian, you took my question about the Impossible meat. So, because I do like those, and the Impossible sausages or Beyond Burgers. That's what it is. Beyond Burger, Beyond sausages. Those are pretty good. So could you again define what red meat is? I think I came in a little late because I was having issues. And go ahead and do that first. I'll ask Mike. Yeah. Define it again.
That's very simple. 4 legs.
If it has 4 legs, don't eat it.
If it has 4 legs, it's red. If it has 4 legs, it's red meat.
Got it. Okay. And is there, with the fat and gaining obesity in the United States, many people are following various diets. Are you advocating just a strict vegetarian diet? And or what do you advocate for a diet then if you don't want to eat anything that has 4 legs?
Yes. Let me say this. I am pretty much plant-based, right? I mean, I don't mind if somebody puts a little cheese on my salad or whatever, but I'm pretty much plant-based. However, I would say scientifically, I talked a lot about the health effects of red meat. I would not say that there are the same. I would say there are not the same studies with chicken and fish or dairy, for the most part, that there are with red meat. That is, with red meat, you can clearly show all these things that I showed. You can't show the same thing with chicken, fish. Now, would I encourage you to go be plant-based? Yeah, definitely. I think it's the best way to eat. I'm happy as anything that I eat that way. I enjoy my food as much or better, more than I did when I ate all kind of things. And so I would encourage you to move in that direction. Now, you don't need to do it overnight, or you don't need to say, well, I'm going to give up all animal products. I mean, the way I started was I said, I'm going to not eat animal products before lunch. And then I said, well, that worked pretty well. And I said, well, let me try maybe before dinner. And then I tried that. That worked pretty well too. And then I said, well, let me give it up for a few days. It's so you ease into it. You don't have to do it all at once. You kind of learn more about recipes, things that are good, just taste good. Do you like? So that's an excellent way to move towards a plant-based diet. I think the overall thing is to recognize probably the best way to eat from a scientific standpoint, a plant-based diet.
And my follow-up question is, because I do enjoy the Forks Over Knives Netflix video over the plant-based. That was a really good movie. If you guys haven't seen it, you should watch it, Forks Over Knives. And 2 Forks Over Knives too. So those are good. And I'm going to withdraw my next question. So, because I think you've already, I'm sorry. What is it? Do you, is the statistics and everything that you gave, is that because people were eating meat every day or just once a week?
No, the statistics were, looking at an increase of 1 serving per day. I showed many of those things. Some of the other studies were people who ate 1 serving versus 2 versus 3 versus 4. But, so basically it's, and there aren't a lot of studies looking at, well, what happens if you eat it once a week or twice a week? You just can't get to that fine level of detail. But I think generally you could say, it's a little like smoking, right? You say, well, can I smoke
once a day? Yeah.
Yeah, you can, but it's probably not the best idea.
I see your point. All right. Thank you.
Okay, any other questions? Greg, any questions? Anybody?
I believe he's on. All right. Thank you very much, Dr. Martin. And I guess that's it.
Thank you for letting me give the presentation. I hope, again, I feel a little bit like I want to be a messenger because it's important information, but you know, this is a hard topic and it's difficult for a lot of people. We've all grown up with eating red meat and bacon, and listen, I did the same thing, but I'm now at a place where I feel better about my diet.
But there's so many mixed messages in the world, right? Like there's the keto diet's good, and you can lose weight quickly on the keto, and this is how your body consumes sugars. It's so confusing, but it's good to hear your message.
There are a lot of mixed messages, yes. But bottom line, eat real food, mostly plants, not too much. That's
Okay.
real food, I mean unprocessed. Thank you.
Okay, we'll see y'all later.
Thank you very much. Bye-bye.